I'm Cheryl Preheim in the 11 Alive newsroom. We are breaking into programming with a special report. Governor Brian Kemp has made an announcement that the first death of Georgia from the coronavirus has now happened. A 67-year-old man has died. He was in the hospital at Wellstar Kennestone. He tested positive 5 days ago on March 7th. The governor says this is a man who had some underlying medical conditions. Again, this is the first death from coronavirus in the state of Georgia. Right now, we have 12 confirmed cases in Fulton, Floyd, Polk, Cobb, Bartow, and Lee counties. We have 19 presumptive positive, which means there's one positive test, but they're going to the CDC for a second layer of testing. We're expecting to hear more from Governor Kemp coming up during a presser at 3 p.m. You can watch it live here or on our 11 Alive YouTube channel, and we are posting all the information as we get it for you on 11alive.com, also sharing it on Facebook. Again, a man in Cobb County has passed away, the first death from coronavirus here in the state of Georgia. We'll have a press conference from the governor at 3 p.m. I'm Cheryl Preheim along with Caitlin Ross in the 11 Alive newsroom. We have a special report to share with you. Governor Brian Kemp has just confirmed the first death in Georgia from the coronavirus. It's a 67-year-old man. He was in the hospital at Wellstar Kennestone, that's in Cobb County, and he tested positive on March 7th, so 5 days ago in the hospital. The governor said the patient had some underlying medical conditions. Again, this is the first death in the state of Georgia. So right now we have 12 confirmed cases. So the counties that we know have confirmed cases are Fulton, Floyd, Polk, Cobb, Bartow, and Lee. There are also 19 presumptive positives, which you know, Caitlin, just means they need a second layer of testing for that final confirmation.
Right, and I think that that's important to highlight there, that the CDC is telling us right now they are confirming those positive cases, so we are expecting those numbers to go up. We've been tracking this very closely, looking at what the numbers are, when they're coming in, and that's been really critical to get to people, is how many people have been exposed to this virus and then how many people have tested positive, because we know those numbers are going up very rapidly.
And we know there's testing being done as we speak, and for an all intensive purposes, you know, it's there. It's a, you know, to quote the superintendent of Fulton County Schools, it's arrived on our doorstep. Right. So what we do know is that the CDC is asking everyone to take necessary precautions. And we do know, as the Department of Public Health has been tracking the cases that are now here in Georgia, that the trend is these are older individuals or individuals with some underlying medical conditions, which was the case with this 67-year-old man in Cobb County who has passed away. And those are the people who need to take extra extra steps. And I feel like as a community, those are the people we need to really support in extra ways to make sure that they have the care and support that they need, because they are the most vulnerable to this virus. We don't know a lot about the virus. There are still a lot of unknowns, but what we do know is that the older population and those with chronic illnesses of any age are the ones that are vulnerable.
And then when we talk about the people who are vulnerable, it's this social distancing that's going to help keep them safe. So it's not just you only need to be concerned if you are elderly or have an immunocompromisation. It's you also need to take steps that are going to help other people. So that means washing your hands frequently, not touching your face, which is really hard to do, as we found out. We've done reports on how often people are touching their face, not washing their hands after they grab the doorknob, and that's how this is spreading so quickly. We've had Fulton County now close down their entire school system. They're back to school today, but they have 2 schools that are going to be closed for the next 2 weeks, because they're going to sterilize every single place that students come in contact with, every place that students touch, because they've now had 2 of their teachers that have tested positive for coronavirus. And when you have that exposure, it's knowing how quickly it spreads. So I'm getting a lot of questions right now from people who may have students at one of those 2 schools, or whose children work at a business where someone has tested positive. And they're saying, what do we do next? So it's important to get that information out too, in terms of you know you've had an exposure to it. Well, now what? What do you do?
Sure. If you're just joining us, we want to share with you that the governor has confirmed that we have the first death from COVID-19 here in the state of Georgia. A 67-year-old man who had been in the hospital since March 7th when he was confirmed to have coronavirus. He passed away at the hospital. He was at Wellstar Kennestone Hospital in Cobb County. And I want to share with you a little bit of what the governor has shared with us. The governor writing, "I know the medical professionals on site did everything that they could, and I greatly appreciate their efforts. As our state continues to address this pandemic, I urge Georgians to remain calm and support their neighbors and communities. We are in this fight together. Our hearts go out to the family and friends of this individual and the hospital staff who cared for him." Absolutely sending our thoughts and strength to the family and friends of this man, and to all who are either on that confirmation list or on a presumptive confirmation list, or those who have been in contact. Because as you talk about schools and different confirmed cases that we know had contact with the greater public. And as the governor points out, it's important to remain calm, it's important to be informed, and it's important to take the steps that our health professionals are asking us to take. And thank you to our healthcare professionals. I have talked to a number of nurses who are working in various hospitals describing what they are seeing every day. And people are nervous and they're worried, and they are going to hospitals for care, whether they have it or they don't have it. And so they're really on the front lines, and we thank you for the work that you're doing, and I'm glad the governor pointed that out, the ones that have been caring for this man who had hoped so much for a different outcome.
Right, exactly. And I think it's so important to highlight that, because I talked to my own doctor who said it's a scary time right now, because so many people are coming to them and they don't know what to expect, and they're really looking for any sense of understanding about what's going on. I think when we talk about the fact that we don't know that much about this virus, that's because it's a pandemic. It's a global, worldwide new thing that we're learning about in real time. And that's why it's so scary. And I think that's why it's so important for us to really make sure we're reinforcing the facts, not fear of this, not feeding into this hysteria, a crisis level, but also recognizing that it's very important that we are talking about real-time information that's happening. When we were talking in our editorial meetings this morning about how people can prepare for this, I thought it was so sad. We were talking about someone who was at a grocery store. It was a new mom who was shaking because she was so scared. She wanted to do everything she could to protect her family, but she was in the grocery store not knowing what she should buy and how could she buy food that wouldn't expire and what should she be looking for. So I think it's important that we address the fact that this is very scary for a lot of people.
Yeah, and to keep it in perspective, I mean, this is where we are. We now have our first death here in the state of Georgia. But the World Health Organization and the CDC continues to say that 80% of cases will be mild. Right. And I think 12 or 13% might have a little heavier symptoms, and 6% are people who are facing critical illness, and those people are our vulnerable population, people 60 and older, those who have underlying health conditions, and that could be at any age. And so that information is important perspective that keeps everything in a way to balance those things in your mind. I think, you know, knowing more actually is a tool.
Right.
Knowing the facts here can be a tool to help us make informed decisions, not panicked decisions. The CDC has been very clear saying that it is good to prepare. Just to have, they say, 2 weeks worth of, have Tylenol, have the kinds of things that you would need to have if you had an illness that kept you and your family home for a couple of weeks, or if it was, a storm that you needed to have things and you didn't have the opportunity to go to the store. That's the kind of preparation that they are suggesting that I think is important, but to do that in a way of, okay, this is what they're saying, we're going to do that, not in a way that is panicked.
Right, panic and makes people feel hysterical. I think too the preventative measures that people can take are important, talking about how do you do that social distancing, how do you not isolate but maybe limit some of that social contact. It seems like every 5 minutes we're getting another email about an event that's been canceled. So we're talking about big sporting events, charity galas, conferences, like all of this is being canceled, and people are really upset about it, saying, if I'm not going to get really heavy symptoms, why does this event needs to be canceled? Well, there's an interesting chart that I was looking at, and it's stopping the spread, so flattening the curve. So if everybody gets sick really fast, you're going to totally overwhelm the healthcare system, and then they're not able to respond. So if staying home this weekend means maybe 100 less people are infected, that means 100 less people who are going to the hospital, going to their doctors, and it gives the healthcare system time to breathe. Because even if most people don't get really severe symptoms, they're still going to be going to the hospitals, they're still going to need care, and this really gives them a way to spread out the spread of disease.
And to think about it in a bigger picture. I know we're disappointed that the Final Four that we were hosting in Atlanta and we were very excited about isn't going to have fans, but wouldn't most people gladly give up a ticket to be in there to help prevent another family from suffering in the way that this family in Cobb County is suffering today? And when you think about it that way, these are really small things that we can all do. We have to take a moment at this space in our lives to say, all right, no fans at the Final Four, the St. Patrick's Day Parade postponed in Savannah, MLS season stopped, NBA season at a halt, and it feels big, but in comparison to the impact that some of those choices could make to help families and slow the curve or prevent other people from getting it, then you say, okay, we can do this, we can come together, that's a way we can support each other in the community. Just want to reset again for anybody just joining us here. I'm Cheryl Preheim here with Caitlin Ross in the 11 Alive newsroom, and just a bit ago the governor of Georgia, Brian Kemp, shared the confirmation that we have the first death from COVID-19 in Georgia. The information we do know about this person is it's a 67-year-old man, was at Wellstar Kennestone Hospital in Cobb County, of course. Had some underlying health issues. In addition to being 67, he went to the hospital on March 7th and tested positive, and had been there ever since and has since passed away. The Centers for Disease Control and Prevention says that people are at higher risk from the illness if you're 60 years or older, people with serious chronic medical conditions like heart disease, diabetes, and lung disease. We know that COVID-19 has an effect on your lower respiratory, so maybe not as much as the congestion here, but in your lungs, and that's how it can differ for symptoms of allergies or the flu. So that's an important distinction. As if you're not feeling well, that's something to talk to your doctor about. Do you feel anything happening in your lungs? If you're at higher risk for serious illness from COVID-19, this is from the CDC, because of your age or your serious long-term health problems, it's important, they say, to be prepared in the event of community outbreak. Just be ready to stay at home for an extended period or limit your exposure to the virus. Have extra prescription medication on hand. Stock up on the over-the-counter medicines that you would need if you need to treat a fever or some of your other symptoms, and have 2 weeks worth of household items, some groceries and water that you would have ready if you are not able to leave home. So that's the recommendation from the CDC. So there's something everyone can do to be ready and to avoid these big gatherings. Many of them are being canceled. The ones that aren't, everyone has to make a personal decision about how they feel about those.
Right, and I know that the people who are in charge of these big gatherings really struggled with that. Like I was supposed to be at a big gala on Saturday, and it's a huge and important fundraiser. It's how they fund programs that really make a difference in the community for the entire year. But they had to take a step back and just say, there's going to be 700 people in this room. This just isn't going to be a safe environment. When you look at these recommendations from the CDC, from the Department of Health, who are saying very clearly, at this point, we need to be avoiding large crowds. And again, you see the graphic on your screen here, just to reset. We just heard of the first death in Georgia from COVID-19. It was a 67-year-old man. He was at Wellstar Kennestone Hospital. That's in Kennesaw, Cobb County. He tested positive 5 days ago on March 7th and did have underlying medical conditions. We are going to hear more about this very shortly. Governor Brian Kemp is holding a press conference at 3 p.m. this afternoon. We're going to make sure that we take that live so people can have all of the necessary information. And I think the governor has been really on the front lines of getting us this information very quickly. If you remember when we got the first case in Georgia, he held a 10 p.m. news conference.
Yeah.
So he's making sure that he's giving the information that's available to us when it is available.
And we're also hearing from a lot of people frustrated, thinking they're not getting the numbers updated.
Yeah.
Why is it taking so long? There must be more happening. And it is all these tests are going through the CDC
Right.
for that final confirmation. And so we are sharing whatever information we're getting from the state, and we just give you our word. As soon as we know it, we'll pass it along to you. Again, we have our first death from COVID-19 in Georgia. We're going to carry the governor's press conference at 3 o'clock, and just know that if there's more information that you need to know, we will certainly be here and cut in and share with you anything that we know. We'll keep updating all our stories for you here on 11alive.com, on our YouTube channel and Facebook pages, and cut in as we need to on broadcast as well. So for now, we will say goodbye and let you know. We'll see you if we have any other updates to share.
So this individual is,
Yeah.
All right, folks, if we can make two lines kind of a little bit, 'cause we're going to switch it. So, Carden, if you kind of want to slide up, you can kind of stand between.
In between. There you go.
You right there. You're perfect right there. See, there we go. Looks great.
You don't get in front of me. I'm moving.
They're getting breaks in the audio line. Okay.
Dr. President, how are you?
General King. After the mayor's done. Yes. She knows.
No worries.
All right. Audio check, 1, 2. This is an audio check for a Thursday press conference at 3 p.m. Are you guys still getting a break?
It's good now.
It's okay. There isn't a gate on it, but if they're talking from a distance, then there might be an issue. So, all right. Thank you, guys.
Felipe. El alcalde está aquí. Okay.
every time I take my dogs
You know, public health officials told me their sleep's been
Yeah, that's what I heard. Healthcare professionals that you sleep and food is a big deal.
We don't do that. I know you're working on it. Oh, yes, sir. Okay. Look forward to hearing.
Yes. I have to take myself seriously.
What are you telling him with all these? And no, it's him.
He's
So the way it works is Mr. David Cohen here is actually deaf.
Right, I understand.
Yeah. And so what's happening is
you
I'm
interpret.
hearing what y'all are saying,
So it's going to
and
you
then I'm
and to
making
him.
it for him,
Got it.
and then he's making it prettier.
Good. Good. Okay. With a little delay.
We are good.
Yes, they are.
Thank you for doing it. I'm sure there are a lot of citizens that appreciate the fact that y'all are here.
There are many citizens.
That you're here.
It's our
That's
pleasure.
impressive.
I chair health, so I deal with it.
Right.
And I know, and I understand.
Oh, yeah. Norte. El norte, el norte, you find.
Turn this on. Really? All right. Are we having an issue with cabling or? Huh?
We're all having the same issue.
Okay. I gotta fix an issue. You know.
Oh, yeah.
We're going to speak to each other.
By me.
We should all have our leader taken before.
Aaron?
Testing 1 2. Testing 1 2. Much better.
You got brand new batteries in it?
There's got to be a lot more people. Press is broke.
One more.
Yeah, always.
You get fixed.
For now.
Limit on exposure to germs. Don't have enough consistency. Problematic.
You're right. No, no, actually. So very few people would actually recognize the accident. Yeah. Yeah. Very few people actually recognize the accident. Huh?
We're trying to concentrate here.
He's fine.
We're inside the wire. We're inside the same side. We're co-located. They're on the other side of the runway, and we're on the other side of the runway. They're on the other side. So
No, you see, we got a little, we got
we have mine
a
outside.
wireless thing.
She wants to bring the kids. If we get time at the end, I'm gonna take them over and see how it's done or something. If we get time.
Oh yeah. Yeah, you get big points for that.
Raise your stock significantly.
Yes.
All the rest of this.
Why do it? It seems like with all the different things that they just interfere with.
Oh, no kidding.
I think we're all sharing sleep deprivation and family separation.
It's still dropping? Sorry.
Hey, Chris, let's use the lavalier. Let's use the lavalier.
Yeah, I like what you said about yeah.
What's that?
Go as is then.
We're all just in case.
Yeah, no, you're okay. You're right. It's okay.
Yeah. Yeah, that's on.
Okay, now, thank you.
Here, dude.
I got it. Both of them, so it's okay. Get your wired up.
What if we just got
Folks, get your wires to the top. I'm good, it's good, but get your wires. Put it up on the mic stand, something like that.
Yeah, let's do that. No, we'll go as is.
Can you give us a quick mic check?
Yeah, I'm gonna do another one. 1, 2.
I don't know if we're carrying your live stream. Keep talking.
All right, check 1, 2. This is for the press conference on Thursday at 3 p.m. 2020. Testing 1, 2. Press conference 2020. Thursday, March 12th. We should be good to go. Are you guys all good? Okay.
No, man, I do not want to mess up someone's ear. Yeah, man.
Okay. If you can just post whenever, like you can post right now and hit the link, watch the live stream there at gpb.org. And I'll have it on the live. Okay. Everybody's good now?
Yeah,
as good as we can be.
Like it's deep in your lungs. If that is a determination beyond maybe a cough or not feeling well or a fever, that's really a time to talk to your doctor. If you feel like you're symptomatic, you need to ask your doctor for a test. And again, the governor has told us that no one would be turned away for a test as a doctor orders that test. Want to reset if you're just joining us. I'm Cheryl Preheim here in the 11 Alive newsroom. We're waiting for a press conference from Governor Brian Kemp to update us on the efforts statewide as we continue to try to stop the spread, slow the spread, contain whenever we can as people are in quarantine of COVID-19 here in our state. And the governor is going to make these remarks to all of us just a few hours after he shared the news with the state that Georgia now has its first confirmed death of coronavirus. A 67-year-old man. He was in the hospital at Wellstar Kennestone, that's in Cobb County in Marietta. He tested positive on March 7th and had been in the hospital ever since. Again, 67 years old with underlying medical conditions. And that really is very consistent with what the State Department of Health has told us about those who are most vulnerable among us, those who are older and have health conditions. So Governor Brian Kemp will share now the latest on what the state is doing in terms of COVID-19. Let's listen in.
Come on in here, speaker. All right, well, good afternoon, everyone. Thank you for being here. I'm joined today by Lieutenant Governor Jeff Duncan, Speaker David Ralston, Atlanta Mayor Keisha Lance Bottoms, of course, Dr. Toomey with the Department of Public Health, General Carden with the Georgia National Guard, General King with the Department of Insurance, and Fulton County Commission Chair Rob Pitts. As you all know, over the past few weeks, we have been working around the clock to address the impact of coronavirus in Georgia, making plans for the future, and giving timely updates to the public. I can assure you that we will continue to do that. We appreciate everyone who is heeding the guidance of federal, state, and local officials. Before I get into specific updates, I want to start off with this. All of you have seen that we're starting to have large event cancellations and school closures across the country. As a result, we're hearing from people in every region of Georgia asking us for advice. In many ways, our message continues to stay the same. We would like to ask people to continue to follow best practices of your health with regular hand washing, avoiding large events if you're sick, and once again, let me remind everyone that this information continues to be available through the CDC and the Department of Health. But here's where our message is changing. Elderly Georgians and those with chronic underlying health conditions face a much higher risk of adverse consequences from exposure to coronavirus. We must take extra care around elderly individuals, people with ongoing health issues, and those who have a suppressed immune system. We need to help them dramatically limit their exposure to the public for the foreseeable future. Health officials are now telling us that these vulnerable populations need to avoid mass gatherings and locations with high traffic counts of people, even faith-based services or events. I've already had this conversation with my mother to keep her safe and plan how we can get her what she needs in the weeks ahead. We cannot be too cautious in this area, and I would urge you all to do the same. Starting as soon as possible, I'm calling on all families across Georgia to get together and talk about how they're going to protect their grandparents, how they're going to protect their loved ones with health conditions, and how they'll come up with a game plan for getting them what they need: groceries, prescriptions, and other necessary supplies. Last night, we announced that there were 31 confirmed and presumed positive cases of COVID-19 in 12 counties throughout our state. Today, it is with great sadness that we have to report the state's first patient death from COVID-19. The individual, a 67-year-old male, was hospitalized at Wellstar Kennestone since testing positive for COVID-19 on March the 7th. In addition to being infected with coronavirus, this individual had an underlying medical condition. Marty, the girls, and I are continuing to be in prayer for this individual and his or her loved one during this incredibly difficult time. I know that the medical professionals on site did everything that they could, and I greatly appreciate their efforts. Our hearts go out to his loved ones, friends, and the community, and we also continue to pray for the safety of the healthcare providers across the state who are working hard on patient care. Out of the new confirmed cases, one individual is a resident of Lee County and is hospitalized. The source of the infection is unknown. One individual is a resident of Cobb County and is hospitalized. The individual has a history of travel outside the United States. One individual is from Floyd County and is also hospitalized. The source of the infection is unknown. And 3 of the newly confirmed cases of COVID-19 are residents of Bartow County. 2 of those individuals are hospitalized and the sources of infection are unknown at this time. Based on our initial investigation, it seems that these cases may have had a connection to a local church in the Bartow County area. The 3rd individual is not hospitalized, and while the source of the infection is unknown, this individual does share a connection with the individual from Floyd County that has been mentioned previously. The Georgia Department of Public Health is also awaiting confirmatory testing from the Centers for Disease Control and Prevention on 3 new presumed positive cases of COVID-19. 2 individuals are from DeKalb County. Both are hospitalized, and the source of their infection is unknown. There is no connection between these 2 cases. The other 2 presumed positive cases involve a resident of Lowndes County, and that individual is hospitalized. The source of the infection is unknown. As the number of cases continue to grow, we continue to closely communicate with our K-12 and higher education communities to ensure timely decision-making for families as well as the stakeholders involved. The Georgia Department of Education, University System of Georgia, Technical College System, and local school leaders have been invaluable partners to determine the best measures to protect students, teachers, and administrators. For local school systems, we've already seen limited closures in specific areas to deal with the recent cases of coronavirus. We know that school closures have a major impact on our Georgia families. Given the rise of the coronavirus cases, along with the push for more school closures, I'm going to issue a call to action for community leaders, educational leaders, and child care providers across our state. If you feel that it is prudent, you should consider closing daycares, schools, or school districts as early as tomorrow through the next 2 weeks. In addition, county and local governments should consider what closures might be appropriate that do not affect essential services. I want to emphasize that this is not a mandate. At this point, we believe that local decision-making is the right course of action and that you have the flexibility. Regardless of whether you stay open or decide to close, we will support that decision. At this time, I am not shutting down state government or the Georgia State Capitol. However, I am immediately suspending non-essential travel and implementing telework policies for most state employees because it's simply the right thing to do. This arrangement will prevent substantial disruption of services to our constituents, but also help mitigate risks. We will be sending out guidance to all agency leaders shortly after this press conference to ensure that they have the right plans in place for implementation. Also, we'll issue directives to the Departments of Behavioral Health and Developmental Disabilities, Corrections, Juvenile Justice, and Veteran Services regarding visitation. Until April 10th, 2020, department facilities will completely suspend visitation except for next of kin and end of life situations. This decision, as you can imagine, was not made lightly, but we must do what we need to do to keep our people safe. These populations are in close contact, some with underlying health conditions that, if exposed to coronavirus, could result in a serious medical problem or cause widespread infection. Yesterday, as you know, I sent a letter to Speaker David Ralston and Lieutenant Governor Jeff Duncan, who are standing with me today, to request $100 million in the revenue shortfall reserves to address the spread of COVID-19, ensuring that Georgia has the resources at hand to enable us to quickly and thoroughly prevent the spread of the virus within our borders, which is critical to keeping our citizens safe, maintaining our health network, and mitigating negative economic impact. I cannot tell you how much I appreciate their solid support and leadership on this issue. With their help, we will have more tools available to address our health needs in the weeks ahead. Given the quick rise of cases across our state, it is necessary to expand the task force reach and build working committees for detailed briefings and analysis. Today, I'm announcing the creation of several new working committees to make sure that we're covering all of our bases for coronavirus here in our state. First, I'm creating the Emergency Preparedness Committee, which will be chaired by General John King, our state's insurance commissioner, with the mission of analyzing the availability of necessary supplies and evaluating all logistical needs that we may have. Their job is to continue thinking ahead, as we have all been doing for the last several weeks, but also laying the groundwork for supply chain needs and demand for critical services, including things that may not be on our radar at this moment. I also will be creating the Economic Impact Committee. It will be chaired by our state economist, Jeff Dorfman, to work with academia, business leaders, and lawmakers on determining both the short and long-term impacts of this virus on economic and financial sectors. I've asked Lieutenant Governor Duncan and Speaker Ralston or their designees to serve on this committee with us. I'm also creating a Primary Care Physicians Committee to be chaired by Dr. Ben Watson. To make the best decisions for our health network and to have an open, consistent line of communication, we need to hear from and coordinate with medical experts who are familiar with providing frontline medical care. As you all know, Representative Watson, or Dr. Watson, is a veteran in this field, and his committee's work will be critical in the days and weeks ahead. We will also be asking other lawmakers who are physicians to serve on this important committee. Lastly, I'm creating a committee to advocate for an especially vulnerable part of our state's population, our homeless community. The Committee for the Homeless and Displaced will be chaired by Atlanta Mayor Keisha Lance Bottoms, who certainly understands the importance of this fight and knows what we need to do to ensure adequate shelter, resources, and care for these Georgians. In the days ahead, we will announce the full committee member list, and I'm looking forward to working with them as we continue to address this health challenge that our state and our families are facing. Before I turn it over to my counterparts, I'd like to leave everyone with a few important points. To address real-world problems like we're facing today, I will be addressing some real-world examples. There are numerous constituents who have raised concern with the state's decision to utilize Hard Labor Creek State Park for the isolation of specific patients fighting infection. Let me be clear. These are non-critical, stabilized patients who do not have a viable alternative for shelter. I will give you an example. Imagine a family with an infant and one parent who is sick with COVID-19. The parent who is sick cannot go home because it risks infecting the infant's only other caregiver. Neither of those scenarios is acceptable. We will continue to use Hard Labor Creek State Park because, quite honestly, some people have no other choice. If your doctor or medical provider has recommended isolation or quarantine, it is critical for you to follow that advice to prevent the spread of this virus, even though you may not be experiencing symptoms. If you ignore this medical advice, you are literally endangering lives in our state. It is simply not worth it. Please, I beg you to please do as we are asking you to do. I want to thank President Trump and Vice President Pence for their leadership on fighting this across our country. They have empowered state and local leaders to take necessary action to keep our families safe. and they've been incredibly accessible as they continue to offer their assistance, but also heed our advice. I also want to thank everyone who's standing here with me today. I know these individuals have been putting in some very long hours and operating with very little sleep, but you would never know it. I'm grateful to this team. I want to thank everyone who's watching or listening and who may be sick with COVID-19 and have them realize that we are dealing with your fellow Georgians in this crisis. We must continue, as we are here today, to be united. They need our support, and we will continue to stay in this fight together. With that, I'm going to turn it over to Dr. Toomey, and she'll give you a quick update. Dr. Toomey.
Good afternoon, and thank you so much, Governor, for your leadership and forward thinking at this time of public health crisis. I wanted to say, first of all, that since we have seen an emergence of pockets of local transmission in Georgia, it's absolutely the right decision the governor made for us to be moving forward aggressively with a change in our message, that to ensure that particularly those most at risk, those most vulnerable, can be protected. And that is, once again, those older individuals, and older means 60 and over, so that includes many of us in the room, as well as those with chronic health conditions, diabetes, hypertension, kidney disease, immunocompromised individuals, including those on medication, for example, for rheumatoid arthritis, that may make you immunocompromised. And please don't go out if you are ill. I mean, what we have seen cases where individuals known to be ill have gone out into the community and potentially exposed others. So once again, personal responsibility, but also protection of our families is critical at this time of this pandemic. I also wanted to just proactively answer some questions that we are getting, many questions in Georgia Public Health about a number of things. People are asking, what is the capacity now for testing? Our capacity is changed even since I last talked with you. We are going to have 2 additional pieces of equipment to do this testing by Monday. Additional staff are being trained to increase our testing capacity. We currently can do about 50 tests a day. We hope by as early as next week, at the end of next week, we will be able to do up to 100 tests a day. We got additional shipments of materials from the Centers for Disease Control and Prevention to allow us to do this testing. And so we have enough for about 500 patients right now, and will continue to request this from CDC. We could not do our job without CDC's help and support. And so I just want to, again, thank them for the support they've given us and all the other states. It's been a hard challenge for them, and we are lucky to be co-located in this state with such a tremendously supportive partner. We've had many questions from physicians. How can we get our patients tested? And one of the things that I've always emphasized is make sure that individuals who want to be tested don't just go to an emergency room, don't just go to a physician's office, because we don't want anyone with coronavirus or influenza or measles to expose those individuals in the waiting area. Call ahead, make sure that these tests can be done. But CDC is doing everything they can to ensure that we have expanded opportunities for testing. They have actually made the guidelines for the PPE, for the protective equipment for providers taking these tests to be a lot easier. You don't need the special N95 masks to wear a surgical mask, and less protective equipment is required. So this means most doctors' offices can take these tests, which will be as simple to do as taking a flu test or a viral panel. And then these can be sent to LabCorp, which is now functioning, and we're getting many test results from LabCorp tests, which are coming directly to us as well as to the provider, and then our public health laboratory. We please ask the providers who are listening, call ahead, 1-800-PUB-HEALTH, PUBHLTH, which is our emergency contact line, to alert us that these tests are coming in, that we can be on the lookout for them and facilitate, particularly if they're high-risk individuals. I know you have a lot of questions about symptoms. What are the signs of having COVID-19? Perhaps no one has done more to help us in this area is Tom Hanks yesterday, when he tweeted about his COVID-19 infection with his wife, and that their symptoms seemed like the common cold. They had malaise, fatigue. I think they maybe had a runny nose and a cough. These are the same signs you have when you have the flu. These are the same signs you have when you have other viral infections. So it's difficult, particularly for those 80% of cases that are very mild, to distinguish between this and other viral infections. So it's so important to ensure that you, if you have a suspicion, particularly if you've been in contact with someone with COVID-19 or have traveled, that you let the provider know ahead of time and go through those steps to ensure the safety of the other patients and the provider's ability to help you. We also know that 20% of patients have more severe disease, and 5% very, very severe disease requiring hospitalization or assisted breathing. And so for those 20% of patients with more severe disease, we again recognize that those with chronic health conditions, those older individuals, are more at risk for developing those complications. So that's one reason why our guidelines coming out today and will be emphasized and emphasized and emphasized in our communities to ensure everybody gets that message and helps protect their family members and themselves. I'll be available later for questions, but I wanted to proactively address many of the questions we've been getting today at work. Thank you.
Okay, now we'll hear from Atlanta Mayor Keisha Lance Bottoms. Mayor.
Thank you, Governor. I want to publicly thank the governor and the leadership of the state for the support that we have received as the capital city of Georgia. The governor has been in constant contact with me personally, and our teams have been in contact with each other, and we could not have a more valuable and supportive partner in this effort. On a local level, we have taken actions that we feel address the needs of our respective communities. Specifically on yesterday, I signed an executive order halting the turning off of water to any of our customers, in large part because a lot of this has to do with washing our hands and the ability to access running water. We are also encouraging our employees who are feeling very anxious about what's happening to take leave if they deem it necessary for their physical and emotional well-being. On tomorrow, the city of Atlanta will test its teleworking policy, and we will then make the decision next week accordingly. I just want to address one rumor that was falsely reported in the media that we had an employee who tested positive. That is inaccurate. But we will continue to monitor our employees. Lastly, we will continue to work with our partners, including our partners at the school system, to make a determination if students are sent home for the next few weeks, how we can work together to make sure that food is delivered to families accordingly. And I'll just lastly leave you with some age-old advice that my grandmother used to give to me. You don't worry until you have to. The reality is that the vast majority of us have not been infected with this virus. But the best counter to what we are facing is preparation. As a city, we are following our business continuity plans. We encourage all of our local partners to do the same, including making evaluations on whether or not residents should be evicted during this time, whether or not electricity and gas services should be disconnected during this time. We ask that we remain the state and city that we are, and that is a place that combines commerce with compassion. Please continue to keep in mind the hospitality industry that is impacted, and to the extent that we are still frequenting businesses, perhaps tip just a bit more. because many of our communities will be hurting, and we will continue to work with the governor and the state as well as our federal partners to determine how we can financially stand in the gap. Thank you.
Thank you, Mayor. General King.
Good afternoon. Thank you, Governor. For those who might not know me, my name is John King. I'm the Insurance and Safety Fire Commissioner. I will be using my experience, obviously, as a senior military officer and a first responder to work with members of the Preparedness Task Force and provide private sector to accelerate the creation of long-term plans and to make sure every Georgian is prepared and ready. This task force will work diligently to coordinate with local, state, and federal agencies to provide the most up-to-date information to all Georgians and to provide practical options for our governor and his team. We will continue to work with the governor's goals and making sure this process is open and transparent. Thank you.
All right, folks, we're going to take a few questions like we've done in the past. If you raise your hand, I'll try to make it around. We'll try to answer as many as we can. Richard, you want to start us off?
Governor, a lot of people are watching right now. We've heard reports a lot of people are in grocery stores right now. They're cleaning out the shelves. What would you say directly to these people about how to proceed in the coming days? Don't panic.
Yeah, I think, one reason we're doing this, showing, and we have a united front, is to keep everybody calm under just, the most unusual of circumstances that we're seeing. Really a historic event, I think, in our state and our country. But as the mayor just said, we have been doing preparedness. We're going to continue to prepare, and we're going to continue to be truthful with our citizens. I think for people that are in the grocery store right now, I don't think you need to buy every loaf of bread on the shelf. Save one for your neighbor. It is not our intention to shut down commerce. I think that's what General King's subcommittee is going to be working on, is the logistics, working with the private sector so we continue to keep the supply chains open. We know that we've got to have critical services open. We know that we've got to have the ability to get fuel, to be able to get health care products. I heard a couple of days ago that the port traffic seems to be ramping up. I think a lot of that potentially is medical supplies that are coming into our port. Well, I can assure you we're going to get those supplies moved. So we are not, cutting the head of the snake off, if you will. We are just continuing to be transparent. We've got, some issues, especially in the metro area, with this virus and the number of positives that we're getting ramping up. That is going to affect our communities. We've heard the angst from our partners at the local school district level. We want to free them up to make best decisions based on what's happening in their community. That is obviously a lot different in, Macon, Georgia, or Dublin, Georgia, than it is in Atlanta and Cobb and Gwinnett, where you've had cases confirmed. So we're going to continue to be prepared, and we're going to continue to get information out. But there is no need for people to panic. We're going to continue to keep you updated. And most Georgians, their risk, as long as they're heeding the advice of the public health officials, continues to remain low. But we're also not going to sugarcoat the issue that, there was a religious, a church that several members have been infected, and that is certainly a concern. So we're going to be truthful with people, and we think that Georgians will heed our advice and best know how to deal with those situations if we do that.
And Greg?
Yeah, Governor, some have accused the government of sending mixed messages. There's some events that are closed, there's some capital that's open, some schools shut down, some haven't. There still isn't a state of emergency. How do you respond to the criticism that you haven't done enough to send everyone one message?
Well, I would disagree with that. I think we've been very clear and transparent about what our message is. We're not to the point where we're, mandating every single public school or asking, our higher education institutions to close. We've heard those concerns from the local level. We are freeing them up, if you will, for them to make those decisions. If we get to a point where we feel that escalates and the public health officials are telling me that, then we'll react. I would tell Georgians out there, I'm not unilaterally making these decisions. I am conferring with the experts, Dr. Toomey and many, many others. Just like today on the task force, one of our subcommittees came out of a suggestion that we had from a task force member. So you have a lot of experts and a lot of people that are really smart working on this issue, and we're going to continue to follow the facts and the science in our decision-making process.
Angelique?
Governor, there are several parents who have students in our public institutions who are very concerned that after spring break this week, it's going to be business as usual back to class, and that we are exposing those students to the virus. What do you say to those parents?
We have been hearing that from the local systems, which is exactly why I've sent the direction today. They are freed up as of this afternoon. If they'd like to cancel, we will support them and do that. If they're in communities where they're continue to have low risk and they do not want to do that, then we'll support that decision. But the school systems, the higher education institutions, the technical college systems, they have all been freed up to take action as they deem fit, and I'm sure that you'll see many of them doing that.
Sam?
Governor Kemp, you mentioned that there are still some parts of the state that are deemed low risk, but we're only able to test 50 samples a day. Public health officials, including Dr. Toomey, have said, as we test, we're going to find more cases. Do we have accurate testing capacity now to know the full scope of this problem in Georgia?
Well, I would let Dr. Toomey speak to testing and the public health part of that, because that is in her lane, if you will. I can just tell you we're following the data and the science that we have. Dr. Toomey.
Thank you. No, initially the public health lab was the only game in town. And we will be free probably by Monday to call cases, not have to get CDC confirmation. But there are now commercial laboratories that are working in our state, including LabCorp, and I suspect others will come in because there is a market for COVID-19 coronavirus testing. And I also believe that there will be hospitals who choose to do testing as well. And so we are just seeing the beginning of what will be a process of expanded testing. And you're absolutely correct. As we test, the more we test, the more we'll understand where the virus is. And our current statistics look a little skewed, and that's because we're testing the highest risk patients, usually hospitalized, usually those with chronic health conditions. And for that reason, our statistics are not individuals who are at low risk. And I think as we do more testing, we'll get a better picture of the statewide spread of the epidemic.
And Dr. Toomey, countries that have really made an impact on this, China, South Korea, have rolled out large-scale testing.
Italy.
Drive-through booths. Is that something that you would expect?
Absolutely. We are actually working right now to identify testing sites that are not associated with hospitals or health departments, that will be staffed and will be open, and that providers can, around the state, send individuals to be tested. I think it's going to be difficult to not be tested without some sort of referral from a physician or other healthcare provider. But our goal is to have those set up statewide, not just in metro area. And some of those will be set up as early as Monday.
Rule.
For the governor, the speaker, and lieutenant governor, what is the plan for the rest of the General Assembly?
I may let y'all speak to that.
I think we have a short answer. The Lieutenant Governor and I will be announcing a plan to our respective chambers probably in another hour or so with some detailed information.
It's adjournment versus...
So stay tuned.
Speaker Ralston, is adjournment versus suspension an option? Can you give us a little...
We will address that.
Andy?
To our members first.
Governor, how do you requested the $100 million. How do you feel like that's going to break down? How will that be spent?
Well, I don't think we have an answer for that. When I talked to the Speaker and the Lieutenant Governor, we just talked about having the availability there when we need it, just for safe assurance, to give us resources to work with. We have money flowing down, I believe, as early as today or first of the week from the federal government. The Vice President, I did not get to speak with him earlier. I know someone on our staff did, to give him an update on where we are and talk about some other things, but I know they're looking at other measures and they're already taken. So I don't know that we want to try to get into explaining the funding on this right now, because we're going to have a lot of resources available. I know that they're working on tweaking some of the healthcare formulas to be able to help our hospitals. What the specifics are on that, when we get that, we will let you know, but I know that they are diligently working on that, and I believe I could speak for the Speaker and the Lieutenant Governor. We have great appreciation for that.
Joe?
Governor, I know your office put out a letter yesterday on getting the most up-to-date numbers from your office and from DPH. Those numbers have since disappeared from DPH's website. We've heard from viewers in the Floyd County area where they had cases announced by a hospital on Monday and Tuesday. It took 24 to 48 hours for those numbers to come up on the state's numbers. Do you have any reaction to people who don't have full faith in the state's numbers? When you have Florida, for example, they're constantly updating the number of tests pending, negative results. They're giving age, sex, city, and travel history of patients. Any reaction to that?
I would just let Dr. Toomey speak to that. I know that from my staff's perspective, we've been putting those out on Twitter. We moved from press releases to social media announcements, and we're still updating everything the traditional ways, but just to get the information out as fast as we can. But perhaps Dr. Toomey can speak to that.
Very quickly, this is a late breaking news that we have worked on the development of an online tool that will, as we enter cases in, it will update both the numbers and a map, so you can see the actual epidemiology, the picture of where the virus is. And that website, which will be linked to our public health website, will be up in the next day or two. And so that whether it's the general public or you as the news media can have access to these numbers, not in real time, but will be updated probably every day at midnight, so it will be the most up-to-date. And even the things like LabCorp data will also feed into it, so we will have the best information we have available, both from providers as well as the public health laboratory.
And real quickly, with 2 possible cases coming from the same Bartow County church, has that full congregation been notified? Can you disclose which church that is so the public is aware?
Sure. Our epidemiologists are working in that community to ensure that everyone who is at risk has been notified and taking appropriate precautions, including confinement in their homes and monitoring for the risk period.
Arch?
Governor Kemp, several sporting events have already been canceled. We're expecting thousands of visitors to Augusta for the Masters. Should they cancel that given what's happening all around the country?
Well, I would just tell people we've been in constant communication with all of the individuals tied to the sporting events here in Georgia. We continue to do so. Dr. Toomey, I know, has been in conversations with them, giving her opinion on where we are. They're obviously working with their own teams in that regards. Quite honestly, those events that have been closing have been done very rapidly, and I think, as far as what's going on in Augusta, I know that they're on top of it, and I'm sure they'll have more to say at a later time, but I don't have any sort of pending announcement on that. So I would just tell the individuals that are looking to come to Georgia to stay tuned for what they're hearing from Augusta National.
And real quickly, the economic impacts of some of the Final Four, all of these that are now canceling events in Georgia.
Well, sure, the economic impact is going to be substantial, not only for our state, but for our country. These are unprecedented times that we're in right now, but that's exactly why we put this subcommittee of the task force together to deal with the economic impact of this, so we can be monitoring that daily, working with the Speaker and the Lieutenant Governor and the members of the General Assembly to prepare for that from a budgeting perspective. But I also tell you that these 2 gentlemen and myself, we will be prepared to act. So when this curve heads down and it starts to end, we will be ready to put Georgians back to work and bring our economy roaring back like it was just a few days ago.
And folks, multiple outlets have multiple people here, so I'm trying to give each outlet at least 1 question, so I'll try to get to everybody. Bo?
Dr. Toomey, could you go into a little bit more detail, step by step, how you get to actually be tested from when you're feeling a little ill, when you pick up the phone, to the doctor, to actually being tested? What is the process for that? How do you get from point A to point B?
Yeah, sure. And I think that when I was in this room and talking about the initial test, or the initial case, we went through that procedure, and it was so beautifully done. It was a model of what should happen. The individual had traveled. He considered himself to be at risk, contacted a provider that he believed he might be at risk for the virus. The provider told him how to come into the facility, that he wasn't entering through the front, but through the back of the building, so no other patients would be exposed, did the test themselves in protective equipment so they wouldn't be exposed. The test subsequently couriered over to the laboratory. And that's an example of it working well. I think a lot of people don't know what to do. I'm afraid that many people are going to emergency rooms, and that's a very dangerous pattern, because if they are infected with an infectious condition, not even COVID-19, but influenza or some other infection, they potentially expose at-risk people. And so we want to try as much as possible to reach out to the physician community to ensure they know how to reach us and how to coordinate this, as well as ensure that the public knows how to do this, that it is done in a way that protects them, gives them access to the testing that they need, but also doesn't endanger any of the public.
Scott?
Yes. What do you say, Governor, to those who have said that the public and the private sector response has been it's too much? That some people have said online, and some of large social media following say, this is all overblown. What do you say to them?
Well, I think it would tell them that we're listening to the science and the public health officials, and to the advisors that we have on the task force, many that are with great institutions in our state, and that we're going to continue to do that. Anytime you're in a situation like this, you're going to get criticized. I think we're making the right decisions. I think we're staying ahead of the curve. If you look at Ohio, they just closed all their schools. I was told right before I walked out here, they had their first case 5 days before we did. So our actions today, freeing our school systems up to do what they need to do, I think keeps us ahead of that curve, and we're going to continue to do that. I hope this thing is overblown, but if it's not, we've got to do everything in our power to keep our elderly loved ones, and those who are especially at risk of dying from this disease, to do every single thing that we can to protect them.
And Stephen, Governor, with the state employees being asked to telework, is that going to disrupt a lot of the state offices that people may rely on in times like this?
Well, I think we're putting a directive out that urges them to do that if possible. We know that people have to have physical interactions in our offices, but if we're limiting some of the staff because they can work from home, it keeps our organization better prepared to deal with someone that may catch the coronavirus, where we could not infect the whole office and have to send everybody into a 14-day quarantine. These are things that we've been thinking about for weeks now. So it's not a mandate that they all telework, but it is an option. It allows them to take different kinds of leaves that we have in the state government right now, to share that leave. I mean, these are things that we've done before in state government. We'll continue to use those tools as necessary to make sure that we do our end to get our citizens and our constituents what they need from government agencies.
Riley?
This is one probably for Dr. Toomey. You said we can expect more cases, the public can expect more cases, but should Georgians be prepared for more potential deaths?
Well, I think it's inevitable as we see the spread of this virus. We'll see many, many more cases, but also to remember that the majority of the time, 80% of the time, this is a very mild disease. And we are right now testing the most severely ill people. And so the rate of poorer outcome among the currently known cases is going to be much higher than if we actually had a screening program to screen every Georgian. That right now isn't feasible. That would clearly be ideal, and as your colleague said, that's what other countries have been able to do. And as we increase lab capacity, we'll certainly be able to have a better idea of that, and perhaps have an opportunity working with CDC to do some broad population-based screening to give us that information.
Haley has one for the mayor, I think.
Mayor Bottoms, thank you. Could you give some guidance to parents of Atlanta public schools about what's being done to protect the students, to give parents forewarning if they need to be prepared to take care of their students similar to Fulton County schools as well?
Certainly, we are deferring to the school system on their business continuity plan, and as a city, we will certainly support and assist where possible. We recognize that the closure of schools will be a hardship on many parents, so we are also working to determine how we can deliver food to students who rely on free and reduced lunch and often rely on their attendance at school to be fed. So we will take into consideration those things that we normally do in case of a snowstorm when the city is shut down, and not only our students but also our senior citizens and our more vulnerable residents. But we are going to work closely with the school system, but we are also going to follow their lead in terms of what their business continuity plan would be for a situation like this.
Okay, folks, and thank y'all. I will be around, so if you have any other questions, I can try to answer.
Governor Kemp, wrapping up questions in the press conference. There is a lot of ground that he covered, and I want to just go through a little of it, sort of the major points in case you didn't hear everything. Overall, Governor Brian Kemp saying for our state, we need to be aware that the message is changing. He said for older, more vulnerable Georgians, people over 60 and anyone with maybe a chronic illness or their immunity is compromised in any way, his words are, we cannot be too cautious. Today, the first death in Georgia, a man 67 years old who had underlying health conditions. So the governor today making a call to action, saying that schools, K through 12, child care providers, community leaders, so local governments, county governments, saying they have the green light. If they feel, in his words, it's prudent, if it's necessary to close down for a while, he's saying you have the freedom to do that. He's also letting them know if you don't feel that is where your specific organization is at, you don't have to do that. The other bullet point I think that's important is the governor talked about from this point forward, for the foreseeable future, no visitation at elder care facilities except for next of kin in end-of-life situations, saying we must do everything we can to protect the vulnerable and our older population in Georgia. Testing, another big highlight, I think important to really talk through what Dr. Toomey was saying about that. She's saying, I want to read her words because this answers a lot of questions that we're getting into the 11 Alive newsroom. She said, our current stats look skewed because we're only testing the highest risk, not those who are at low risk. As we do more testing, we'll have a better, more clear, more accurate idea of where we are as a state in this pandemic. She said it would be ideal if we could test everyone. That is not, it's not possible where the state is now. We're working towards that. Where it stands right now, they're able to do 50 tests a day. There's more equipment and more people being trained. By Monday, they're hoping that will be 100 people a day, and they're going to continue to expand the labs and the hospitals and the doctor's offices that are doing that. But if you have been looking at the numbers and wondering to yourself about them, she's talking about why that is the case, because right now they are saving their tests for the highest risk individuals. We are right now in confirmed cases, 31 cases in 12 different counties. Mayor Bottoms said it's really a time to think about being a community, calling for compassion, thinking about each other, saying the best way to face this is through preparation. And that goes on an individual level and as a state. The governor talking about expanding the coronavirus task force in terms of a group addressing preparation, a group addressing the economy, a group addressing healthcare and doctors' response, and a new